One of the ways that we get business at Caring Medical that's pretty frequent is referrals from chiropractors because they have young athletes who get meniscal tears. And anyone who treats young athletes knows that, first of all, there's a lot of false positives on MRIs. So an MRI will commonly show a meniscal tear in a young person when no meniscus tear is evident. And plus, the most common treatment for meniscal tears, even in young people, is they remove part of the meniscus. And that puts a lot of pressure on inside the knee, so it accelerates articular cartilage degeneration, which of course you wouldn't want to do in a young person. So it's very common for Caring Medical to see young athletes who have quote-unquote meniscal tears. Sometimes that's true, but more often than not, they just have ligament laxity. Like, in other words, you do an anterior drawer sign or you move the knee around and they have, anterior instability or knee instability. So prolotherapy to the ligaments that support the knee, as well as injecting substances inside the knee to stimulate meniscus tear. And because young people are growing so much, they respond very, very well to prolotherapy. So I would really encourage young athletes, whether it's a meniscal tear or other injury, since you heal so quickly, please don't get surgery unless you absolutely need it. And even before surgery is scheduled, you really should get a consultation by a prolotherapy doctor, because kids, what might in older athletes take 4 or 5 visits, in kids it's like a couple visits.